surgery, this is why a lot of girls don't like to talk about it, because people are so judgmental. The way that they judge surgery girls, this is why people be and don't say not a damn thing to anybody. But today, I have to say this before I start.
I feel make your mind up. Girl, I love you, plus I never make you minus. If I let you smoke it, you gon' lose my lighter. If you paranoid, then I'ma spend the night. You thinking I love you every day. Diamond dancing,
Oh, welcome back to the channel. We have another chit chat video going on. I know. I'm trying to do the chit chat videos in between the weekly vlogs. I think it's gonna be like a good little flow. Y'all love the one with the friend and foe. The way that y'all was commenting, baby, listen. And on IG too, yes. So in my mind, I was like, okay, let me do another chit chat. I was literally debating on the F-boy and the surgery. I feel like the surgery should be like the one to go to next. You know, I don't want it too much into like all the time relationship stuff. So I'm gonna leave the F-boy stuff for the next chit chat, because that one's gonna be really good too. All right, so if y'all new to my channel, my name is Valentia V. I'm a family nurse practitioner, so I only vlog on my week off. On my week on, I'm saving lives in the ER, so I can't really bring y'all. It's HIPAA violation. Y'all want them to take my poor little license, baby? They already saying that we're not professions anymore. That's another day for another story. I put that on the weekly vlog, baby. When I tell you I went in, just prepare yourself. Anywho, so when I'm off, y'all get to come into my life. I don't have a niche, y'all. I literally take you like I take my kids everywhere. In the beginning, I'm not gonna lie, I was a little hesitant. I was a little afraid, so I was holding back because, baby, one thing about my life, when I do these edits, I realize, V, you really baby, let me put myself in some Jesus. Anywho, so I'm trying to get back into like the little chit chats. I used to do them, and then slowly but surely, I don't even know how it fell off. I really don't know, y'all. But this segment, this chit chat will be about surgery. I know so many y'all write me on IG and tell me, can y'all please go into details about the surgery, this and that and this, and we doing it right now. So I have to give a little, because when it comes to surgery, this is why a lot of girls don't like to talk about it, because people are so judgmental. The way that they judge surgery girls, this is why people be and don't say not a damn thing to anybody. But today, I have to say this before I start. If you're a type of girl who says, I like my body how it is, I pull the same guys that you pull with the BBL bodies, please get off this chit chat. If you the type that say, oh, y'all just insecure, that's why y'all getting y'all body done, honey, you're insecure about that nose, and that's why you always be putting that filter on, because you know in real life your nose is this size and you really want it to be my size. But do I come for you? No, I don't. And matter of fact, when I check your followings, honey, you're following more BBL doctors too. Why are you following the BBL doctors? Oh, because you're manifesting. You're manifesting. Just say you can't afford it, honey. It's okay. Because us girls who get our body done, we never come on platform and talk about how bad y'all body looks. We never do. Because we don't care. Like Cardi say, I'd rather die on this surgery table than to look like you. Yes, honey. Like, I don't know why y'all so fixated on something that y'all really want to. So please, get off this chit chat if you feel like that. Okay. The surgery girls who like surgery, I welcome you. We're gonna get into it. Anybody who knows me will tell you, baby, since high school, I already knew that, baby, I was gonna get surgery done. Ain't no ifs, ands, or buts. I love surgery, y'all. When I tell you I love surgery, anybody who knows me knows, baby, I ooze and eat this thing up, literally. So we're gonna start off with this. The difference between a BBL body and a butt shot body. I know y'all get into y'all ruffle feathers when people like Jada Wada, Jay Nice, Bernice Burgess, Cardi B look y'all in y'all face on IG on their posts and they say, I don't have a BBL. Y'all go crazy. Well, your before picture showed your butt like this and now it's like this. Let me tell you why. There's a major difference with a BBL girl and a butt shot girl. A BBL girl consists of a doctor, a plastic surgeon, takes an instrument, a cannula, and suck the fat out of your arms, in between your thighs, around your stomach, your back. This is where they get lipo 360 from. 360 means a whole circle. So we're finding the fat everywhere around your body. This is where 360 come from. Now we're injecting your personal body fats into your hips, into your butt. The hip thing started around 2015-ish. That's when the hip thing started. Before then, people was just getting their butt very big. And then from the front, it looks like they don't have no butt until they turn to the side and it's like, whoa, what is that? Like, you got a badonkadonk back there. Until somebody, I don't know who the surgeon is, decided to say, you know what? Let me fill your hips in a little bit and let's see how that's gonna look. And this is where we get the hips, y'all. The thing about BBL is, yes, there are some girls who have natural big butts, get lipo 360 and only inject it into their hips only. You're still considered to be a BBL girl. I know people be like, but I didn't touch my butt. There is girls that are like that who don't touch their butt, but they just got their hips done. I think that girl Neek, if I'm not mistaken, she's a very tall girl, gorgeous girl. She got her hips done and she actually hates her hips. And I'm gonna tell you why. And I will tell you what happens that surgeons don't know. Y'all have to also give a little bit of grace to these doctors, y'all. Y'all not giving the doctors grace enough. We're gonna dip into that also too. Okay. The difference between a BBL girl and a butt shot girl. The BBL girl, her booty is not going to be symmetrical. It's not. Some BBL girls are very jiggly. Like, it looks like water is in the, like the butt just moves so nice, so fluidy, like it's ridiculous. Like, the guys know for a fact between a BBL butt and a butt shot butt, because when they're hitting it from the back, their hip area, they get very pain when they, you know how some guys want to hit it really hard. So that hits this area of the pelvic area that they have, and it hurts. And they tell you, like, man, it hurts. It's hard. Some butt shot girls are very hard. Over time, it's soft, but over time, it gets hard because it's the body rejecting that gel. A butt shot girl is a girl who was never placed under anesthesia. Is a girl who actually went to body house, basement if you're in New York. They lay on their stomach, they put some X marks around, and they inject a gel into their butt, or what they call silicone. Sometimes they mix the silicone with caulking, with different substance. You don't know what they're mixing with. Mind you, these people are not doctors. If you're not a doctor, you're not going to get FDA approved medication to inject into a human. This is why you have to have a license, so you can get the proper medication to do the proper stuff that you need to do. Med spas do butt shots, but it's hyaluronic acid gel shots that they place in. I know y'all probably gonna be like, well, girl, how come they don't just get a BBL? these type of girls, they don't have fat on their body. Remember, I told you, you have to have fat to get pulled, to inject. If they don't have fat, what do you think they're going to do? And they want a big butt. That's their option. Drea Michelle, all of them, they don't have. This is why y'all think like they go to the gym, they do all these sit-ups and they do all of this, their stomach touching their back. Their stomach been touching their back, honey. They're just naturally thin girls. So they came into the terms of having slim thick. Like they're very slim, but they got a nice bubble butt, right? The thing with the BBL girls and their butt, if you get it too big, people are now starting to realize these things grow over time. The BBL girl will not have a complication like the butt shot girls will. The butt shot girls will have discoloration. Now you're going to see the lump in their butt after years go by. But in the beginning, when they freshly get these butt shots, oh my gosh, their butt is so round and perfect and symmetrical. You hit that butt, it bounces back at you like whoa, like this is, you can tell the difference with a butt shot girl and a BBL girl the moment they start to go in the gym. The butt does not move. The butt does not go up. The butt does not go down. Baby, the butt just stay the same. Everything else in their body changes. You see the legs get really skinty. This is how when you know, okay, yeah, this girl most likely she is a butt shot girl. There are some girls, yes, their legs is very skinny, but it doesn't go hand in hand. If they're a thick girl and they found the fat, they're actually going to be thicker because wherever they got the fat from, the fat is not going to go back there anymore, y'all. It's just not. It's just going to go everywhere that it no longer, that it's not there. That was never sucked out, basically. This is where you get them linebacker shaped girls. Like they're very big on top. Their waist is so small. And then down here is huge. Over time, it gets like that. And then their face is really big, but you're like, dang, everything is big except for the waist. Yes. And then the waist, it does not, it gets wider because the thing is, you cannot suction fat from your organ. That's the only thing that you cannot suction because you'll die. You'll die, right? So that's why I myself, I love plastic surgery and stuff like that. But when it comes into the butt shot world, I do not agree to butt shots. That's the only thing that I look down on when it comes to cosmetic surgery procedures is the butt shots. I do not condone getting it because over time your body sees it as a foreign object, like K. Michelle. See it as a foreign object and it fights it. And the problem with the gel is the gel spreads. I have not yet seen a doctor who can perform this procedure a safe manner and have the person authentic butt to begin with looks the same. And a lot of the girls, the problem is when the gel gets into the vascular system, they can't sit on their butt for too long because it's like it's occluding. It's like when you take a hose and you turn the water on and then you put your foot on the hose, you see how it just backs up? Well, yeah, that's the type of pain that they feel. So that's why they can't sit on the butt for too long because they start to feel that pain. And then once the blood flow stops going, now they start having leg pains because your legs is in search of the nutrients of the blood and it can't find it. So you see why I don't like butt shots. I've never been a fan of it. I knew about butt shots before anybody else in the world. Like anybody, like butt shots was known to the girls who worked in the strip club. They were very thin. They didn't really have enough fat and they just wanted a bigger butt because at the time, a bigger butt meant more money, right? So that's why I don't like butt shots. Okay, now let's get into the surgery world. You want surgery. If you want surgery, y'all, let's be realistic. Some of y'all don't be realistic about your bodies. Some of y'all really don't know how. I want to be Delulu like how some of y'all be Delulu. Y'all be out here misshaped, but in y'all mind, y'all think y'all gonna come off the table looking like Drea Michelle, looking like Kim Kardashian. No, baby. Let me tell you something. Your surgeon is like a chef, okay? Your body is the ingredients, the vegetables, the rice that you bring to your surgeon, your chef, to cook. If your body is not up to par, baby, your results is not going to be up to par. You can't be mad at the surgeon. I know there's some people, I'm not gonna lie. You have to realize there's some doctors out here, they just want your money. It is what it is. The real doctors, they're gonna tell you, you know what? You need to lose some weight. You need to do this, and then come see me, and then I could sculpt the body how you want me to sculpt the body. But the pictures that you're showing me, you're not being realistic about the situation at all whatsoever. We're gonna start off there. Please be realistic with your body. You can't come here with a waist 44 and thinking that you're gonna get a 28 waist. Baby, that's impossible. Are you serious? But the doctor who wants the money, guess what he's gonna do? He's gonna do it. Because all he has to do is the procedure. That's it. Y'all could get mad at the results, but baby, in his mind, he knows. He's like, but am I gonna give up on this money? No. That's why you have a lot of these girls with these lip fillers, these Botox. They're starting to look weird in the face now. You know why? Because the person that they're going to is money hungry. If they tell them, no, do not put more in your face, that product is still sitting on the shelf. They're wasting money. They're not getting the money that they need from the product A and into their pockets B. A lot of these cosmetic places, med spa places, they're not really looking for your best interest. They just want the money. It is what it is. So we got down to the realistic. Be realistic with yourselves. If you need to lose 30 pounds, baby, lose the 30 pounds. Because you want to come out looking fantastic, right? That's what it is. It's really about what you're giving your doctor. Your doctor is not a miracle worker. He's not a voodoo priest. He cannot change you into a goat. It's impossible, people. Really, really it is. And a lot of times that you got to realize too, a lot of these girls, I'm not going to lie to you, they Photoshop their pictures. A lot of these girls who did get the work done, some of them really still Photoshopping their picture. I know y'all gonna be like, but their waist looks so small. It just, you have females who have body dysmorphia. And it's very real in this community. In the surgery community, body dysmorphia is humongously big. I have body dysmorphia when it came to my boobs. When I first got my boobs done, I felt like my boobs were too small until my surgeon told me, and he showed me, he said, do you remember how you walked in here? Let me show you a picture of how you walked in here. When he told me that and he showed me my before and I seen my after, I was like, yeah, you freaking tripping. Body dysmorphia is real in this surgery community. So if you're not mentally prepared to say, I remember how I look like before and how I look like now, do not get into the surgery world. Surgery is just like getting a tattoo, honey. The moment you get one, you're fiending for another one, you're fiending for another one. Now you tatted on your chest, your face, your back, your arms. Now you look like a damn Crayola crayon box, baby. Now you regret it. I told y'all I regret my foot tattoo. Out of all of my tattoos, my foot tattoo is I don't know what I was thinking, but I got into that realm of, ooh, I like to get tatted. I like the little pain from the needle. I know y'all probably gonna be like, girl, what? There are people who like pain. It is what it is. I have a high pain tolerance. I had both of my kids natural. So my pain tolerance is up there, honey. If I tell you I'm in pain, you best believe it. My pain, when I say I'm in pain, it's like I broke a bone. That's how high my pain tolerance is. Even Beth seen it for her own two face. Beth was there when I had my kids. Beth actually, well, CJ, Beth actually held my leg. Beth was there when I got my nipple pierced. She was like, V, you didn't even scream. You didn't even say nothing. I was like, that's it? Beth was like, what the hell? That's just how I am. Pain, like, I have a very high pain tolerance. Okay? So we got into the body dysmorphia. We got into the make sure you know how your body looks. Let's be realistic with the body. Okay. Now we're saving money for this procedure. We made our mood board or our goal board. We're pacing bodies that kind of look similar to the body that we want to look like, correct? Now we have to find the surgeon. This is where a lot of girls messed up at. A lot of girls who don't have a high pain tolerance, they just want a one and done all. They want the lipo, they want the BBL, they want the tummy tuck with the boobs all together. Honey, it does not work like that. Would I go to Leslie knowing Leslie don't do eyebrows well, but I know she's fantastic with hair? But in my mind, I feel like hair is hair. How can you not shake my eyebrows if you know how to cut a very nice blonde butt? I said blonde. I'm so used to this blonde hair girl. How can she not shake my eyebrows if she knows how to cut a bob really nice? Eyebrows is not her forte. Hair is her forte. I get it. You feel like hair is hair. Listen, I'm a type of person, I go to the person who specializes in what they specialize in. I don't go to a BBL doctor who specializes only in BBL and want to ask for boobs from him. It's not happening. The only doctor that I've seen who specializes in only one thing but is fantastic in another thing is Dr. Altman. Altman, down here in Miami. His specialty is rhinoplasty. He only does nose. He tells you, I'm just a nose doctor. I'm very good at nose. But guess what this man is fantastic in? Mwah, luscious boobs. His breast game? 10 mode. A lot of y'all famous girls who first had their boobs done and then they went to redo their boobs again, they went to Dr. Altman. That's how much of a goat this man is. But he would tell you straight up, I'm not a boob doctor, y'all. Like, I love to do rhinoplasty. But since I capitalize off of it, I might as well just continue to do it. What can I say? There's like missing hits in the game. But not all the plastic surgeons know how to do everything. I know y'all hear plastic surgery or plastic surgeon and you think he or she specializes in everything plastic surgery. That's impossible. It's impossible. I get it. They can do it. But what does the final results look like? That's the bigger thing. I'm your model. When I walk around here, I'm your walking billboard. Some of these doctors don't give up about that. They don't. They don't. And some of them do. There's some of them that will see you and they'll be like, ooh, I'm going to make you into a Barbie. I already know it. I already see it. You're going to look like a Barbie. Beth will tell you, when I went to go get my boobs done, my doctor wanted me to go bigger. He was like, no, you need to go 450. I was like, what? I was like, baby, I'll look like a porn star. But in his mind frame, he's Caucasian. And what does Caucasian men love? Big boobs, slim look. And at the time, I was slim. So in his mind, he feels like, okay, you will look like the perfect Barbie. Like, you'll have the big boobs and you're slim and you're tiny. Like, yeah. Ask Beth. Beth was in the room with me. I said, Beth, no. I was like, I'm not going no bigger than what I've already thought of. I'm just going to do 400 cc's. Now that I look at it, I should have did only 350 cc's. Ideally speaking, because I did not know I was going to gain this weight, y'all. That's another topic that we have to expose, but we're going to expose that at the end because we're trying to find our doctor now. We found our BBL doctor. Our BBL doctor specializes in this. Our BBL doctors say it's $6,000. Or I know a lot of guys, a lot of BBL doctors are now $5K. There's some doctors like Dr. Chung, $15,000 off rip. He's not playing because he knows how he's going to scope you is going to be like a Colombian doctor or Dominican Republic doctor. I know some girls, they be afraid to go to the DR, to go to Colombia. I get that. But your top-notch doctors from foreign countries, trust me, if you cough in that office, they're canceling your appointment. There's some out-of-country doctors who don't play, who's more strict than the doctors here in the U.S. Dr. Duran? Dr. Duran from the Dominican Republic? You cough in her office, she cancel your appointment. She don't play that. She asks you how many kids you had. Did you have a C-section? Have you ever been diagnosed with sickle cell? The blood work that you got to do for Dr. Duran, baby, you even have to do blood work for hemophilia. Hemophilia is if somebody cuts or you get a cut, you bleed out, meaning you don't have platelets to bind. Platelets is like your Band-Aid in your body. The body sees that you're bleeding, it automatically coagulates, means it stops the bleeding from happening. There's some people who don't have that. You will bleed out, you will die. There's a lot of doctors who will tell these girls when they first go to them, oh, I can't do you. You're high risk. If I touch you, if you go into this, getting this done, you're going to die. You know what they do? They go behind their back and they go find another surgeon who says yes. There's always somebody who's going to tell you yes. Because they want their what? Money. Now you're dead. Now you're casket ready. All because of what? You're not listening. There's women out here who have blood disorder. They can't get the procedure done. But they want it so bad that they're going to go ahead and they're going to risk their life and they're going to do it. Are y'all listening to me? This is where safety comes into matter. Like, I know when y'all hear these girls who pass away, sometimes a surgeon warned them already. And I don't want to hear about DC Young Fly wife or girlfriend. She did not die from surgery, y'all. She literally had a complication. When she was complaining of having a headache, a proper doctor, I work in ER, any of my patients who come in with high blood pressure, complaining of headache, or just complaining of headache, or high blood pressure, my first immediate thought is do a brain scan, do a CAT scan to make sure that they don't have an aneurysm, they're not having a hemorrhagic stroke. That's my first thing. If the CAT scan comes back negative, guess what I put in next? An MRI of the brain, just to make sure, and I keep the patient there until the patient gets the MRI of the brain. This is how you practice proper medicine. This is how you make sure you cross your T's and you dot your I's when your patients come in and they're complaining about a symptom. You know what they told her? Take ibuprofen and go to bed. You know what ibuprofen does? Ibuprofen literally, to me, I feel like ibuprofen is a blood thinner. You go on your period right now, you have severe cramps. You take ibuprofen, the cramps is gone, but look how you bleed out. Like the period just keeps coming. It just keeps. We don't give ibuprofen or NSAIDs to patients who have kidney problems or to patients who have bleeding disorder. We just don't do it because it's more higher risk of you bleeding out, literally, right? Now we done hit the safety part. We did our blood work. Our hemoglobin is up. We're taking our iron. We're taking our folic acid. We found a good surgeon who don't have a lot of deaths. I know a lot of y'all be like, but that surgeon killed this, that. If you would see the amount of people that this surgeon has touched, you're going to have some complications. You're going to have deaths. It happens in the hospital too. You might come in for elective surgery. Even if we're taking out your appendix, we tell you there's a risk of you possibly passing away. Sign here. you sign. The only thing about it is that's more of an emergent procedure. You can die if your appendix explode. You could go into sepsis, septic shock, and you pass away. Okay? I don't want people to feel like you can't pass away from certain procedure. Every procedure that you go through, there's a possibility of you passing away, y'all. But the only difference why people look so much down on deaths of plastic surgery is because you didn't need it. It wasn't warranted. That's why so many people be like, girl, you should have just left your body how it was, because you would have not died. But let that same person would have went to the hospital complaining of abdominal pain. We do a CAT scan of the belly. It shows they have some kind of problem with their appendix, and we realize you got to get the appendix removed, and they pass away. Then it's more of a surgeon fault. It's not the human fault. It's not the human being that came to the hospital complaining of this. You see how the paranormal of the activity of going on, it can be vice versa. Okay, y'all, my camera is overheating, so if it cuts off, I'm gonna come back. So we got the safety in, we got the money. This is where a lot of people really mess up at. They only save money for the procedure. Baby, that procedure is the cheap route. After the procedure, the aftercare, it's the same amount as the procedure. So ideally speaking, for you to get this procedure done, you would need at least $10,000 to $12,000. This is why a lot of these girls go to the DR or go to Colombia, because it's cheaper. Even the aftercare is cheaper. But overall, I'm not going to lie to you. When you put in flight, food, nurse, the doctor, the Airbnb that you got to stay in for those 2 weeks, because one thing about out the country, you have to stay for 14 days. Oh, y'all, so the camera cooled down. Where we stopped at? We stopped at the 14 days. Yeah, so overseas, you have to stay 14 days. So that's the only give and take. It comes out to the same amount, y'all. It really depends on if you really want that Barbie look. And some girls, they like that unrealistic look, and some girls want a natural look. There's some girls who had a BBL done you wouldn't even know. I think the rapper Doechii, she was on some kind of podcast, and they're basically trying to shun BBLs, and they basically told her, see how your body looks so natural and so good, like that's the type of stuff guys want. And she straight up told them, I had a BBL. They're like, what? She's like, yeah. There's very wide spectrum of the BBL. Y'all have to realize, I know a lot of y'all be commenting about the girls who's shaped like a wisdom tooth, who's shaped like a bell pepper. Y'all, there's some girls who, that's what they wanted. They wanted the bell pepper look. That's why they went to that doctor to give them that look. But what happens over time is it grows. And a lot of people don't tell y'all that, but it fluffs and it grows. The doctor is unable to tell you this. My doctor told me straight up with my boobs, if you gain weight, they're gonna gain weight with you too. I just did not know that it would be to this extreme, right? Anywho, I know to y'all feel like my boobs are not big. My boobs are humongous compared to what I first got. People who knows, Beth will tell you, baby, this was not my boobs were so cute. Like, it had like a nice little teardrop. It was up. It's still up, but it's not up how it used to be up. Like, it used to be up. But mind you, I'm 8 years post-op. So that tells you how good my doctor was compared to my lipo doctor. My boob doctor did not do my lipo. And that's why my body looks the way that it looks. That's why when girls be like, who did your body? Who did your body? And I'm telling them who did my body. They're like, oh, wow, okay. It's two different people. It's two different people. Actually, it's three different people, because my first lipo 360 BBL is not my second lipo 60 BBL. And my second lipo BBL, he mostly fixed my hips. He didn't even touch my butt. So, but that's how I tell you, it's still a BBL at the end of the day. The moment they touch your butt, touch your hips again, they consider you to be a BBL. And that's another thing that a lot of girls don't realize. One part of your body, the fat might live a little bit longer than the other part of your body. For me, I was able to determine and see one side of my hips was a little bit bigger than the other side of my hips. My surgeon seen it and he was like, we got to fix that. I said, okay, no problem. He fixed it for me. To y'all probably would not even realize it. Beth didn't even realize it. I had to point it to Beth in a picture. Beth was like, oh yeah, I kind of see it. But that's the thing that a lot of doctors are unable to tell you, is how your body is going to take the fat that is your own fat. Sometimes the fat dies. I think they have it to where they feel like 30% of the fat that they do put in will pass away, right? So now we paying the doctor, we got our money saved up for the post-op care, because the post-op care is another $5,000 to $6,000 with the massages, the faja, getting the fajas taken in, eating a proper meal diet, because they want you to eat. When I tell you eat, they want you to eat. Now we're on the surgery table. Okay, we did all the safety regulations. We got our blood work done. We know we don't have high blood pressure. We know we don't have these blood disorder problems. It's surgery time. You're going to be scared. You're going to be terrified. Your blood pressure is going to be through the roof. If anybody sits here and tells me that they had surgery done and they weren't scared, you're a monster. And they need to list you for the war. Because what? How are you not scared? My heart, even me as a registered nurse, was pounding so bad. The plastic gown that it's not a plastic gown, but the cloth gown that they put on me, baby, I was sweating. Baby, you would have thought somebody said you owe the IRS some money and I just did not have the money and I knew they was going to come for me, baby. The way that I was sweating, baby, the way that I was sweating, they put the IV in, they tell you to put your TED hose on. They come in, they mark you. This is where you have to show your surgeon. Do not be afraid to tell him what you want. If you want a voluminous butt, you tell them I want a voluminous butt. For me, I tell girls, do not put fat on the bottom of your butt. Overall, I feel like the girls who put the fat underneath the bottom of their butt, after 5 years on down, the butt starts to sag. It's like it's holding too much. Now you look like you got a wet diaper booty. Nobody wants that. Nobody wants that. I'm so sorry. That's why a lot of them girls, you be like, oh, when you see them on IG, you see them in person, you like, whoa, what is that? Yeah, over time, it expands. That's why any girl that I see is humongous, like got a big butt, I'm like, girl, you ain't going to regret it, because you're not going to find nothing to fit you. And now you're spending more money on jeans that you have to take in the waist, because your waist is probably like a 26, 25. Your hips is like a 52. They don't make jeans like that for nobody. All you're going to live in is tights, 2-piece sets that are stretchy, tube top dresses. As you could tell the girls who have the voluptuous butts on IG, their whole pictures, 2-piece sets, stretchy clothes, Poochie clothes, because Poochie is very stretchy. chrome heart tights. It's something with a stretchy material to it, because you're not gonna find jeans. You're definitely not gonna find shorts. Good luck on the shorts too. I myself, my hips is only a 46. I have problems with shorts. Express is my favorite store that I buy my shorts from, and Fashion Nova. Fashion Nova, I feel like it's made for like the BBL girlies, because they cater to our pants, like to the bottom of our, to our bottoms, our butt, right? Okay, we show him the pictures. He's marking us. He's showing us, okay, what I'm gonna do. I'm gonna do this. I'm gonna do that. He brings you in. You get the lipo done. It's like it happens like this, y'all. Y'all wake up. Y'all in post-op recovery. The way you're going to be shaking, you're going to be shaking like you having a seizure. You're going to be like this. Duh. You're going to be like, first of all, your body is still numb. The girls who don't have a high pain tolerance, they're screaming. You hear 15 girls screaming, oh my God, help, help. And you're like, whoa, what the? I swear to you, it's the scream that wakes you up. It's the scream that wakes you up. So they come in, they see that you're awake, and they're like, are you okay? How are you feeling? Are you in pain? Do you want us to get you some pain medicine? You're like, yeah, just a little bit so I can have a comfortable ride going home. When you wake up, you're on your stomach. Yes, you're on your stomach. You have the faja on. You still got the socks on. They tell you to keep your Ted socks on. You're on your stomach. If you want something to drink or eat, or they don't feed you, y'all. They give you like some crackers and some juice just to make sure that you're not throwing up. They give you that. You sip. You take your pain pill. You go home. The ride home, you're on your stomach. Ass tooted and booted in the air in the back seat. If you're going to go to a recovery house, you go to a recovery house. I was a nurse, so I really didn't need it. I recovered on my own, y'all. Like, fuck this shit. I was like, man, I ain't paying nobody to come do what? Take a blood pressure in me? Like, ain't nobody gonna, man, please. I recovered on my own. My first round, I recovered on my own. My second round, I recovered with my boyfriend at the time, because I was with my boyfriend. And I basically told him what to do for me, and he was doing it for me, right? So the next morning, you have to go back the next day, like early in the morning. The doctor has to come see you. He sees you, you get your first massage. This is where you're going to get your first massage. They take that faja off. Bitch, you going to be mad. You going to be like, what did I do to my body? You're black and blue. You're bleeding. You're swollen. The swelling? Your face is swollen. Your hands is swollen. You look like an Oompa Loompa. You thought you was going to come off that surgery and be like, you ready to go clubbing? George. Georginette. What? Baby, you going to do a double take in that mirror. You going to be like, what the did I do to my body? In the moment they take the faja off, all the blood just shoots down. You feel weak, you feel dizzy. They're gonna sit you down somewhere just so you don't pass out, because it's like the faja was holding everything in, and all of a sudden they take it off, and you're just like, baby, weeble wobble, but you won't fall down, baby. You feel like this is where you're gonna regret it. This is where all them girls you see on IG when they be posting their picture, they liked it then. Hit them up 3 weeks ago and see if they were like, what did I do to my body? What? I thought I was gonna look like Kim Kardashian. Baby, you look like you just went in the ring with Floyd Mayweather and Mike Tyson, and they double tagged your ass. Now you regret it. Now you're like, what? It gets worse. They tell you now you got to get your first massage in. The moment this lady puts her hand on your body, you're screaming. I didn't scream, But I heard the girls in the other room, baby, they were hooting and fucking hollering. I was like, what is, you would think somebody was murdering them. They start literally molding your body, because now your body is like Play-Doh. This is where you don't want to play with your body. Your body is like Play-Doh. Anything that you put on your body right now is going to stick. It's going to last. This is why they put the belly button, there's like a little prosthetic thesis that they put in your belly button to keep your belly button open. But everybody now realize that's all a hoax, because the way that they lipo the form of the belly button will never form like that again, basically. Mind y'all, I told y'all I'm not a guru on tummy tucks, so I'm not talking about tummy tucks. I never had a tummy tuck. My stomach is flat like this because it's flat like this. I never had a tummy tuck, so I cannot tell you about a tummy tuck, y'all. Just a little disclaimer, because I know y'all gonna be like, well girl, why didn't you talk about tummy tuck? I did not get that done. If I did not get something done, I'm not gonna talk about it. That's just it. So you get your massage done. Now they take you out of the faja. They tell you to go home, wash your faja, take a shower. This is where the girls are messing up at, when they're like, oh, a BBL has a smell, a BBL has a smell. A BBL does not have a smell, y'all. Even if you go to the hospital and get a procedure done, you're gonna come out of the procedure with a smell. It's from the iodine. It's from the antibiotics that they give you to make sure that you don't have an infection. All of this come into play into that smell that you smell. That's why you're supposed to take a very good shower. You wash your faja. You let your faja air dry. Me, I didn't let my faja air dry. I put that bit in a dryer. I just did not let it sit in the dryer for too long. I think I put it in the dryer for like, I think 20 minutes, and then I let it air dry. I would sleep on my stomach for a little while and let the faja air dry, and then I would put the faja on, correct? So after that, they tell you what you need to eat. You need to eat fatty food, salmon, avocado, protein. They'll tell you to drink Ensure by the boatload, because you just had a procedure done, A, and then you want to feed the fat, B, so the fat does not die, right? So eating eggs, Five Guys, baby, I was eating. But they only tell you to do this for a good 3 weeks. After the 3 weeks, baby, don't do it, because it's done for. Now we just have to mold and shape your body. I went to my massages for my first week every single day. My boyfriend was tired of me. My ex-boyfriend, he was tired of me. He was just like, I'm over this. I just, baby, that man was stressed out. One thing about guys in blood, they don't want to see it. And then if they really love you, they don't want to see you in pain. And he just like, I can't believe you just did this, V. What are you thinking? I'm like, my money, honey. Oh, and that's another thing. Another disclaimer. You go and let this man, whoever you with at the time, if he's not your husband, you let him pay for that body, that's on you. He's gonna feel like that body is his body. Literally. He's gonna feel like that body is his body. And if y'all break up and you start to be big on IG, oh girl, man, I paid for her body. Man, I was the one that paid. I never let a man pay for my body. I know these girls be like, get my boobs done, get my BB, jump out, get my teeth done. No. Anything that belongs on my body, baby, I'm purchasing it. I never had my teeth done, but I had Invisaligns. But baby, I did not ask that man for a dime, because y'all have to realize men are more catty and petty than we are. The way that a man would tell another man so quick, oh yeah, I got her body done. Man, that's my money. That's my money on her right now. Quick. And I had that motto before I even started getting stuff from guys. The way that a guy spend their money on you and never let that shit down is ridiculous. Anywho, back to our little discussion. Now you're getting massages every day. Them massages is $75. You do $75 times 7. You do $75 times 10. You do $75 times 20. Mind you, there's only 30 days in a month. Including food. Including your faja. A good faja is going to range you $150. Your waist is shrinking every single day. Do you know how many times I had to go to my Colombian mommy to get my faja taken in? I have it in my vlogs when I used to live in Fort Lauderdale. You can see my old vlogs. I was in that thing faithfully right there in Miramar. Faithfully going to her to snitch that. She didn't speak no English. All I kept on saying is, poquito por favor. Poquito piqui. That's all. Poquito faja. She's like, okay. And then she'll say, mwah, Barbie. Oh, you look good. You look good, Barbie. That's when you know you look good. When the seamstress from Colombia is telling you you look, just know your is hitting, honey. All right, we 2 weeks in. We getting the massages done. We eating. We doing all of this right. Boom. Here comes the depression. Because the depression comes from the anesthesiology. And another thing the anesthesia do to you, a lot of people don't speak about it, is it makes you forget. Baby, when I tell you I was so forgetful, I used to forget like the littlest, even my appointments to go see my masseuse lady. I forgot. I would be cooking something. I forgot what season to put in the baby. The forgetfulness that happens with anesthesia, baby, it's bad. Boom. Now we're depressed. You're gonna be like, V, how are you depressed? Your body is coming in. You getting massages done. You're depressed because you can't go nowhere, honey. Where are you gonna go with this faja on? Everybody gonna be looking at you. Where you gonna go? And all you could do is sleep on your stomach. The only time you up is to go to the bathroom. And that's a whole nother problem that's gonna make you depressed too. Because the way you have to take the faja off, take the board off, unroll it down. You're sore. You rolling it down just to go pee. You finish peeing. Now you gotta roll it back up. Now you gotta put the board in. Now you gotta hook every hook. Hoot, 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 hoot. If you pee 5 times a day, that's 5 times you're doing that. If you pee 10 times a day, that's 10 times you're doing that. The next day, same routine. Go to the masseuse lady. Get your massage done. Come home. Wash the faja. Lay on your stomach. Everybody outside having fun. That's why I be telling people, if you want to do these type of procedures, you got to do them like around October, November, December, January. You're pushing it. Because you need at least 3 to 4 months to actually recover and you could be outside. There's some girls, they don't care. They take that faja off the next couple of days, like the next week, and they back outside. They outside. And I think that's why y'all be feeling like they have a smell to them. It's because they're not properly healed yet. I think that's where the smell is coming from. They're not properly healed yet, and they're not, taking all that antibiotic is still in their system, because they give you antibiotics for a week to take so you don't have an infection. So you pee in any antibiotics you take, you're gonna pee it out. Like, it's gonna do what it needs to do, but the remnants of it, you're gonna pee it out. If you take penicillin, I swear to God, you pee, it smells like penicillin. It is what it is. So I think that's where the smell is coming from. Yes, there is girls that will literally go outside in a week. They don't give a fuck. They don't. There's some girls, it's the same thing like the girls who just had a baby and they hunch and then they go to their OBGYN 6-week appointment. Surprise, you're 4 weeks pregnant. You're like, girl, you couldn't even wait 6 weeks? Yeah. And that's another thing that anesthesiology or anesthesia does to the body too. It makes you very fertile. I don't know why, but baby, majority of these BBL girls be getting pregnant like this. When I tell you, like, baby, they be getting pregnant like that. So you gotta be careful about that too when you in this recovery stage, because you gotta realize you walking around the house butt naked around this man. Your butt looking scrumdiddlyumptious. Your waist is looking small as hell. You think that man ain't finna touch you? You don't think that man wanna see how that booty look from the back when you throwing it back? Well, George, there you get pregnant. Now your body is messed up. You see the precautions that you got to take, baby, you better make that man wear a condom. I don't even want to hear about no pull-out game, because you could get pregnant by a pull-out game. I can attest by that. I can attest by that. So what I'm trying to tell you is, oh Lord, it's a lot when you get these procedures done. You're going to be depressed. You're going to regret it. That faja is going to make you want to choke yourself to death. It's that you and that faja. You and that faja, you gonna want to beat that faja up. I swear to you. But after a while, you and the faja become one. It's like you don't want to not wear the faja. I was wearing my faja out and about, and I was already like a month post-op. I wore my faja for a good 6 months. My Colombian massage lady had told me only for 3 weeks. After that, it doesn't do anything. But mentally, you feel like, oh, I'm going to get more compression. I'm going to get more compression. But she was right. It doesn't really affect you at all whatsoever if you keep it on or you keep it off. It's just all about your eating habits and if you're going to work out. Oh, my battery's about to die, y'all. So now we're in the recovery stages, right? This is where you're going to get mad or you're going to get happy. Because that first month is how your body is going to be. You could do whatever you want to do. That's just how it's going to look. Your waist will get smaller. Your butt will fluff out. It will fluff out to where you be like, what in the world is going on? Here is where you're going to get mad at your surgeon or you're going to be happy with your surgeon. And this is where my battery died. So I left off by saying this is where you're going to be happy with your surgeon or you're going to be mad at your surgeon, right? So I told y'all the time frame to get the procedures done, because I feel like once you hit January, you get the procedure done January, February, March, April, you're good for summer. May, you're fantastic for May is when shit pops off. You have Memorial Weekend. You know, people outside, they defrosting if you're from up north. Like, shit about to be popping. You about to be on somebody's yacht, tooting and booting. You about to be on somebody's yacht. You better shake that ass like your friend do. Tell your mama to watch the motherfucking kids. Like, baby, you outside. Nobody sees your face no more because all you're doing is tooting and booting that booty in the air, baby. You happy. You excited. This is why I tell people don't do it during the summer, because you and that faja in the summer, especially in Florida, they're going to have to put you in a psych ward. You're going to be so pissed off, it's not even going to be funny. The way you're going to be sweating, I know you're going to be like, but girl, I thought you said that you'd be staying home. You're going to want to go outside. And then when I say outside, I don't mean like clubbing. I don't mean stuff like that. I mean, even a little trip to Publix is like a moment. A little trip just to the mall. Because you feel so confined in this house. So confined. But then again, you probably the type of person who really don't want to show off the body yet because you want to take that bomb picture. Baby, that first bomb picture that you take and people be in your DMs like, girl, what's up? What you did? Who was the doctor? That's another inclination of, baby, your doctor was the GOAT. When people ask you, girl, you look so good. Who was the doctor? When you post that picture in that little arrow button that show people sharing, your shit is at 100, 300, 400. Yeah. No, the body is tea. No, the body is tea, baby. What? But you got to go through all of that for that. And this is why I'm leading this topic to this point. If you do your body because you think the body is going to get a man to spend money on you, forget about it. Don't do it. If you do the body because you feel like your ex broke up with you and you want to show them that you're the biggest and you're the baddest, don't do it. But if you deep down inside know, the way I fit my clothes, I don't like how it fits, and I've been working out and achieving a certain type of look that I'm trying to go for, and I just cannot get it to that point, okay. Y'all, me working out, this is not my first rodeo of working out. I was working out before all of this happened. I was working out before I had Cameron. After I had Cameron, you could ask Beth. I got a personal trainer because my weight stuck on my body. It would not go anywhere. I remember my best friend was getting married. She made us order dresses. My dress would not zip up. You could ask Beth because Beth was trying to zip it up for me and it would not zip up. And that gave me the goals to lose the weight. I got a personal trainer. He came to my house and he would train me outside. Beth would be with me. Beth didn't last that long, y'all. Beth gave up. But baby, I just kept going. But I had this fupa at the bottom of my, it would not go away. Don't matter the amount of crunches I did. It did not matter. When I went to my surgeon said, yeah, there's some women, you have to get it lipoed out for some women. It is what it is. So that's what geared me to getting my body done. My boobs, I already knew from Jump Street I was gonna get my boobs done. No ifs, ands, or buts about it. Even when I had my first round, you would have never known that I had a BBL. Nobody would have known because my butt was not that big. Like I didn't want a huge badonkadonk. Like I wanted that slim, thick look. Eventually, when I got with my boyfriend, that's when the shit just boom, 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 boom. It just kept growing. It just kept growing and growing and growing and growing because I gained weight. That's just what it was. I just gained a lot of damn weight. So that's why when people be like, oh, did you get a BBL or something, like, I'm like, no, not really, because I really didn't. I didn't want that look. I just wanted my hips. My hips was like the biggest thing that I really wanted, but because I touch my hips, I am certified a BBL girl. That's just what it is. That's just how it maneuvers, because they did not take the fat and throw it away. They took the fat and they put it somewhere else. You feel me? So the same thing when it happens to my boobs too. Like my boobs, I did it for me because my back looked like my chest and I did not like that. Even in high school, my biggest insecurity in high school was my boobs. I hated my boobs. Like they were pointy and small. I just could not stand my breasts at all. My thighs were always big like this. I never had a thigh problem. I never had a butt problem. I had butt, but I didn't have butt. But I didn't want butt. I just wanted like a cute, slim, thick type of look about me with boobs. And that's why the first thing I ever got done to my body was my boob. That was my 30th birthday gift to myself. I was supposed to go to Paris. I didn't go to Paris. Y'all, I got my boobs done. I got my boobs done instead. That was like my graduation gift because I also had passed and I became a bachelor's. I had achieved my bachelor's in nursing and I turned 30. So I was like, yeah, let me get boobs. I want boobs for my 30th birthday. So now my boobs are 8 years old, but my boobs last how they lasted because I went to a boob doctor. I don't mind the multiple pain. I don't mind spending multiple money because I like how the outcome looks like. That's why so many people be like, girl, you look like you just got your boobs done. And I'm like, no, these suckers, they about to be going to the, is it the 6th grade? No, they about to go to the damn 5th grade. They're in the 4th grade right now. I'm about to go to the 5th grade. It just happens. It's just, if you're going to invest in yourself, don't go the cheap route. This is not underwear or bra, y'all. I understand some of us could get bras from Target. Some of us can get bras from Victoria's Secret. But when it comes to your body, please be careful what doctor you go to, who you're going to. Make sure that they're board certified. Make sure that they don't take a certain amount of girls at a certain time frame. I always try to elect to get my procedures done early in the morning because I know the doctor is not too tired. He's still refreshed. I'm not saying if a doctor takes you at 2 p.m. that he's not going to give you the same results as him taking you at 8 a.m. I just like the fact that he's more refreshed. He had a good night's sleep and he's ready to do the procedure on me. You feel me? But then again, a lot of girls that you see with the voluptuous butts, the voluptuous hips, they went for multiple rounds, y'all. That's not their first round. Like Gizzy Doll been on that table 3 times. Like, it is what it is. Oh, my cousin called me. I'll call her. It is what it is. You feel me? If you want to achieve that type of plastic look, that Barbie look, you have to go multiple rounds. And the multiple rounds that you do go to, it can affect your body also because you'll have something called fibrosis. This is the thing that the massage helps with, is breaking down that scar tissue. Your second round is going to be more painful than the first round because they're literally cannuling into scar. So they got to break down all that scar tissue so they could really suction and lipo you the best way that they could do the second round. That's why the third round, a lot of doctors will not touch you if they found out that this is your third round, because the amount of scar tissue that you have, it can cause the cannula to puncture your lungs. And you don't, because they're trying to jab through the scar, that they might just go straight through and puncture your lung, and you don't want that to happen. That's why they put higher risk for you if you go the third round. I've never heard of people go the 4th round, but I know, baby, there's some crazy body dysmorphic people out here. They will do it. Surgery is very addicting. It's something about you knowing that you could fix something, and the only thing that's hindering you from fixing it is your money. I don't care what anybody say. Having money fix problems. That's all. It doesn't bring you joy. It doesn't bring happiness. It fix problems. As you could tell, look at the City Girls. Look at Carisha before. Look at Carisha now. Look at JT before. Look at JT now. Look at Chloe. Look at Chloe before. Look at Chloe now. Look at Glorilla. Look at Glorilla before. Look at Glorilla now. Baby, money can solve problems, but money does not fix happiness. If you're stepping into the surgery world, you have to be very realistic with yourself, and you need to know when to stop laying on that table, because you will start to look like a walking, how can I put this? A walking question mark of what is this person? Who is this person? I.e. Little Kim. Little Kim was so gorgeous. Oh, when I tell you a gorgeous, gorgeous, gorgeous woman. Like, I remember when I was a kid, I was such in awe of her. And look what body dysmorphia done to her. Like, yeah, I know y'all love to see the girls in the pictures. Y'all love to see how they look. Like, I get it. all of that comes with some kind of sacrifice that a lot of people don't know the realistic life of a body that is getting done, baby. You go through a lot of stuff. It's just like when you getting pregnant, you going through labor for 13 hours, you push out the baby. The moment you hold your baby in your hand, you forget about all that pain until you get pregnant again, and then you like, oh, junk. Damn, I gotta go through labor. Oh my gosh, I forgot. I know so many people be like, but how did they not know when to stop? You don't. Because now you wake up and you feel like you have something else to fix. As you can tell, you can hear from me, I'm now complaining about this. You probably like, girl, that's nothing. But guess what I did? I realized I started having this because I gained a lot of weight. What did I do? I lost the weight. Now that I lost the weight, I realized, ooh, I'm a little too skinny. Hold up. Let me gain a little bit back. So now that I'm 175 compared to 162, I love my weight. I love how my face looks. I love how my waist looks. I love how my butt looks. I love how everything looks on my body. But that's where I'm trying to tell you, do not follow the trend to follow the trend. If you're going to do something, do it because you really want to and you really want this for yourself. Not to make a man jealous. Not to make the new girlfriend that you see on his arm who got a BBL. Now you feel like if you would have got the BBL that he would have stayed. No, do not do it for that. Don't do it because you see, oh, the BBL girl is getting more likes on Instagram than I am. Baby, listen, them likes are not dollars. I don't know why y'all be treating these likes like it's depositing dollars into your account. It's just a fucking like. That's just it. Those followings are not dollar amount. I have 15K followers on IG. You think I have, you think that equates to me having an extra $15,000 in my account? No. This is where I mean you have to be very realistic with your life and what you're doing, because you can cause yourself to die. For what? For what? This is what I mean. Okay? Did we hit everything? So now you're posting the picture. You're having a ball. You're having a good time. You're eating. Do men gravitate towards you more? Yes. But guess what? This is where you have to learn discernment about yourself. A lot of guys just want to see how the ass move when he's hitting it from the back. That's why not every guy can talk to me. That's why I don't go on a date with every guy or sleep with every guy. When y'all see me go on these dates, y'all, I'm not fucking these men. I'm not. I'm not. There's some men that they only took me out on a date one time and they never freaking see me again. Because I have discernment about myself. Any man that I lay down with, best believe it, that man is my boyfriend. Except for one person who was Lil Baby. Lil Baby came into the equation when I did not want to have a boyfriend. Okay? We was in a little situation shit that grew into a relationship. You feel me? But prior to him, every man that I had was my man that I laid down with, I slept. If you see me sleep with a man, bet on my 2 kids, my cooch, that man is my man. That's it. I've been to so many dates. Not one of them dates could say, oh, Valentina was my girlfriend. No, honey. We just went on a date. That was just it. Not one of them men can tell you how I look naked because it was just a date. I'm not that cuckoo crazy for dudes. And you have to realize a lot of these dudes will fix you hopes and dreams just to see you naked, just to see how your butt really looks out of the clothes. That's just it. And the ones who can't really touch them type of girls, because them type of girls, they do come with their hand out. That's why that man, that lawyer said, I'm shocked and surprised you're a nurse practitioner. Girls who look like you usually have their hand out asking for money. See, that's the difference. For me, I got it done for me. I didn't get it done because I needed my bills paid. I didn't get it done because I needed money from men. I didn't get it done because I needed likes from social media. I didn't get it done because I needed followers on IG. I didn't get it done because I'm trying to do an OnlyFans. I didn't get it done. No, I got it done because, baby, I didn't like how my pants look when I wear high-rise jean pants. I got it done because when I wear my skirts, I didn't like how my skirts would look, especially a white skirt. Anything white is going to really show all of your imperfections on your body. I got it done for me, myself, and I. You could ask any of my ex-boyfriends. Even when they were my boyfriends, I never asked them for money. Baby, I would get this hair done faithfully. That's why a lot of y'all cannot determine. If I did not have a vlog, y'all would not know if I was single, taken, married, or not. Because my upkeep of my lifestyle is upkept like I got a man, because y'all be feeling like the only way a female look good is because a man is treating her. A man is paying for her hair, her nails, her bills. No, there's legitimate women out here who clock in, go to work, make a good living to where they can afford getting surgery, afford going on trips, afford going to Cartier and buying a ring, afford going to Chanel and getting themselves a bag, afford sitting at somebody's chair and getting their hair done. That's considered self-care to them. Afford, oh, I love these red bottoms. Let me buy them. Oh, they're only $900? Okay, no problem. I bought the $900 pair of shoes. Like, there is women out here that can afford these things without laying on their back. I know y'all get it to where y'all feel like a lot of women are laying on their back to get these basic, simple stuff. Baby, it's not true. Same thing like not all guys are hoes out here. You can find a genuine men out here that's not going to be cheating, lying, beating on you, but are they your type? No. Do they look good? They probably short and look a little questionable in the face. Only a mother can love that type of face. Are you gonna date them? No, because they not your type. Well, it goes the same thing for us women. Not all of us are laying on our backs to get our bills paid, bruh. I'm so sorry to tell you. I know it hurts to find this out, because some girls, they be feeling like, girl, she an escort. Girl, she do this. Girl, she probably strip at. Trust me. Trust me. There's legitimate black, brown girls out here who get into the money without laying on their back, without sucking somebody dick. I'm here to tell you, I know it's hard. I know it's so hard to believe, but it's so true. It is. It's so true. I kid you not. It's so true. It's so true that y'all can't even fathom sometimes. Like, y'all see my everyday life. Y'all never hear me say, oh, I ask a dude for money. Never. Because I feel like if I have to ask you, then you probably just don't have it. You probably just don't have it. I told you that YN was the first one. Lil Baby was the first one to ever ask me for money. Even my homeboy said, that nigga asked you for money? Yeah. You have to have discernment once you have this body. You have to have discernment once you have this body, because, baby, they coming. Baby, they coming. When I tell you they coming, especially got a pretty face in the body tea. Oh, Miss Ami. This how it's going to be. Beating down. Beating down. And then on top of that, you have to have a stronger back, because these girls are going to be throwing shade at you. These girls are going to be throwing shade at you. Oh, she only getting them likes because the body's done. Oh, she only getting this. Not because you know how to dress. They're not going to put that into it. You know how to dress. The body done. The face is tea. The teeth is tea. Guess what they're going to say next now? Instead of her buying that damn body, she should have bought a house. You bought a house? See, let me tell you something. These bitches could never come for me because a lot of stuff that they would say that they would do with the money, I've done it with the money. I bought the house. Not only do I have one car, but I have 2 cars. I go on trips. I go out to eat. I go to my doctors. I get my blood work done. What else do you want to say? Oh, instead of that, I would have got some degrees. I got degrees. Because that's another thing that they're going to start throwing in your face. Oh, but she don't have a house though. How you got a BBL, you working at Walmart? How you got a BBL and you live in an apartment? How you got a BBL and you driving a Honda? How you got a BBL and now you want to be a bottle girl? How you got a BBL, now you want to be a stripper? Baby, I'm none of those. What's good was tea. What's good was tea. Okay. I'm just telling y'all ladies, the hate is going to come. The hate from the men is going to come too, because plus, believe me, that man that was hounding you down to be your boyfriend is going to be the same man to humble your ass too. Oh, that don't look good on you. I don't like that on you. Knowing damn well, baby, this thing going to turn heads. He comes to humble you too. Mind you, he was gooking and eyeing. That's one thing that I hate when a guy do to me. Do not be pressed to talk to me, and then you talk to me. Now you want to tell me, oh, I don't like weave. I don't like makeup. I don't like this. I don't like that. Monsieur, sir, when you met me, you ain't see all this shit on me? That's like me meeting you and you smoking weed and all of a sudden I'm like, ew, I hate that you smoke weed. Are you delusional? Are you okay up here in the brain? Trust me. And when you get in an argument with that man, guess what he's gonna say? With your fake body. Oh, with my fake body. But this fake body had your twirls throwing gang signs when we in the damn bed though. This fake body had you chasing me on IG, had you chasing me in the club, had you chasing me at the hookah lounge. Yeah. If you don't have the big backbone to get this procedure done with the amount of stuff that you gotta fight, the amount of shade you gotta throw, and I kid you not, I bet you his followings is full of BBL girls. I bet you her followings is full of BBL doctors. I bet you her following is full of it girls who got their body done. Yes, because that's what you want. The it girls on IG don't speak nothing positive. They not saying nothing uplifting to you for you to be following them. All they doing is posting designer, caviar on their hand like this. They AP watch. Baby, what they posting that you so intrigued about? Now everybody's in Pilates. They're posting their Pilates socks. What they posting that's so intriguing to you? Oh, because you're manifesting. You're manifesting, but you're throwing shade, reposting shady shit like, me, you got the same man, but my body is natural. Okay, so why you couldn't keep the man then? Why you couldn't keep the man? I didn't throw no shade at you. Matter of fact, I told you that you was pretty. Matter of fact, when he was talking shit about you, I was actually uplifting you to him to make him feel like he's no bigger than the program. Yeah, y'all better get ready. Y'all who want this body, baby, the body come. Baby, you better get ready. You better get ready. I'm trying to tell you. And sometimes your friend will turn against you because of this body, because she realized that the body's attracting people. It's attracting the boys to her and not to you. I meant it's attracting the bodies to you and not to her. And she's going to feel a certain type of way about it. You slowly starting to realize bitch is not inviting you places no more. Oh. The body. The body. I've never seen a natural girl hanging around with a BBL girl. It's not going to happen. It's not going to happen. That's the same thing like I've never seen BBW girls hang around a skinny girl. Unless that's their family, unless that's their sister. But friendship-wise, I don't too much see it. I don't too much see the difference of the plethora of a friend group like that. I don't too much. That's how catty us females are. That's how catty us females are. And I'm sorry to tell you, reality of the world is that's how it is when you step into this surgery world. That's just it. Baby, this thing does not come with roses and AP watches and baby, it comes with a lot. It comes with a lot. Them AP watches, the moment you want to leave that man, hey, oh, for my non-Creole speaking, the misery this man is going to make you go through, you going to wish that you ain't never put that watch on your wrist, baby. Baby, what? What you couldn't get mama motla? I couldn't get mama too. I swear. That's how much drama these bodies be bringing some females sometimes. Mind you, you just minding your business. You just minding your business. That's why I don't go looking for nobody, ex, because I already know the type of woman that I am. When you look me up, baby, your heart is gonna go into your ass. Your heart is gonna go into your ass because I'm not just a BBL dummy. I'm just not. I'm not a bottle girl. I'm not a stripper. I'm not an OnlyFans girl. I legitimately have a career. I have a house. I have cars. My hand is not out. Matter of fact, that man will miss me more than I miss him because he got to go back into that world of, I need my hair done. I need my nails done. I'm late on my car note. I'm late on my rent. They just shut my water off. They just shut my light bill off. All because of a booty. All because of a booty. If you sit here and you think these strippers don't be, they do. They do. They do. Because you got to realize in a stripper mentality, they see the guys come in and throwing $10,000, $15,000, $20,000. You think that you going to be their boyfriend and you not going to give no money? I see these men throwing money every single night. Yeah. That's why a lot of guys, they get mad at these BBL girls because they cannot afford the BBL girls. Even when they think their money is up and if the money is not stuck, they see what happens. She bounced to the next person. Because it's a give and take transaction. Oh, you thought that this BBL, I wasn't going to make this money back off of this BBL? Oh, baby, I'm making the money back. There's girls out here who made their BBL money not 10 times, 20 times, 30 times, 40 times, 100 times. Because that was their overall goal. That's what they went to go get it for an investment. Is there girls who made the BBL for the investments? Of course. There's some girls who did that. I'm not going to sit here and just be like, oh, people just do it just to do it for themselves. No, there's girls who know like, okay, if I get this done, I'm going to get this. But guess what? Once that sees that, it follows suits. It follows. It just follows. And now you have a world full of what? BBLs. And that's why these guys are not very shocked anymore. They could care less about a big butt. Some of these guys would literally tell you straight up to your face, I could care less about coochie. Can you believe that? Can you believe that? That's how much this thing is being thrown around. The value of Gucci is literally like a value of $1, baby. Baby, it's down. It's down. That's why a lot of these men, they be like, oh, that's all that you could do? You be like, what? Yeah, what you gonna, just give me a piece of pussy? Man, please. I can get that anywhere. Next. That's why they throw females away just like that. Next. That's what I'm trying to tell people. Do it for what you really want to do it for. Don't do it to impress nobody. Don't do it to think that you're going to find a man that has a lot of money. Baby, it's not going to happen, especially in 2025. It's too many of them now. You had a chance in 2010, 2014, 2015. Once pandemic hit, baby, it was over with. It was over with. Now, people can't really differentiate if you got a BBL or not. There's people out here that got BBLs that you wouldn't even know they got a BBL. It is what it is. That's just the lifestyle. So I hope this helps. And y'all see the life of plastic surgery, the ups, the downs. Do you have fun with it? Yes, because no matter what, I'm not gonna lie to y'all. When I wear a two-piece bathing suit, especially a two-piece thong bathing suit, and I'm on vacation, and I sit down and I be in that water, backstroking, baby, you can't tell me nothing, because I know I look good in my bikini. But that's what brings me the satisfaction. When I get dressed and I know I don't have to suck it in just to like, that's what brings me the satisfaction. I don't give a damn about these guys. Y'all see my vlogs. Y'all know V don't give not two shits about the guy. Y'all see, baby, I be dropping them real fast. Baby, I don't got time for that. So for me to sit here and say like I got my body done because of for men, no. And if that's where that you thinking that you want to get it done for, to get items or to get somebody to pay your bills or to feel that you're gonna get loved by these men more, don't do it, because you're gonna regret it. Because the journey that you gotta go through, the itching, when your nerves is trying to connect back again, the swelling, sometimes the swelling don't stop until a good 2 months. You take that faja off, your stomach is rock hard all over again. You gotta go get another massage and put the faja back on. Baby, you gonna realize it wasn't worth it. And sometimes you don't even get your man back. And sometimes the man do come back, but he's slutting you out. He didn't even really want you. He just want to see how the butt look. He just want to see how the body look in person. That's where you have to have the discernment at. That's why you just have to do it for you. That's why people be like, oh, you got your body. Yes, for me. For me, myself, and I, honey. That's it. When I put makeup on my face, I love putting makeup on my face. I love getting my hair done. I don't do it for y'all. I could care less. I don't do it for the next bitch. Who is the next bitch? I could care less. Who are you? I get my hair done because I get my hair done. A lot of these trends that I now see, baby, I was been doing it. Changing my hair color for the fall. Changing my hair color during the summer. I was doing that before it was a big thing to do on IG. The only thing that I never got into doing is doing my hair lime green, blue, hot pink, because I have a career. I don't work at Walmart. I have a career. Imagine me coming up to you with pink hair and telling you, hi, I'm your family nurse practitioner. You're gonna look at me crazy. You're already looking at me crazy because I'm black and I'm a woman, and I'm telling you that I'm your nurse practitioner and I'm actually not environmental cleaning up the room. You already looking at me backwards. A lot of these patients literally, and it's because I'm in Florida, they'll ask me like, what school did you go to? What school did you graduate from? And when I tell them Palm Beach State College, Florida Atlantic University, South University, their mouth is jaw dropped. Yeah, what you thought I was gonna say? A technical school? This is how people look down on black people. So just imagine me with this body and pink hair. They're gonna be like, girl, you in the wrong field. Y'all seen there's so many times where I be like, ooh, this hair is a little too long. With this body too, is gonna give something else. I'm very aware of my surroundings when I do things. I'm very aware of even how I get my nails done. I'm very aware of even when I put clothes on. That's why I ask people where we're going. Oh, we're going here. I already know. We're going to a concert. I don't dress the same way that I go to a concert that I'm going to go to a dinner. I see my environment. I see what it's for. I'm not in Lululand. If you in Lululand, please step away from these surgery tables. I'm just telling you. Because you're going to come in with a rude, hard awakening. Okay? I hope this helped. I hope y'all don't dislike me. I had to tell y'all the truth, honey. I had to tell you the truth. Oh, and another thing is, I have to tell y'all this. People be feeling like, I hear guys say this, and I don't know where guys got this from. They be like, oh, the cooch still feel the same. Of course it's gonna feel the same. I got work done on my stomach and my hips, or i.e. my butt, or I got boobs done. What does that have to do with my vagina? Yes, there's vaginal rejuvenation and stuff like that. If that's not what she went to go do, why do you think that the cooch was gonna change? If it was trash then, it's trash now. It's still trash. It's just trash with a big butt. That's just it. If it was wet before, it's gonna be wet now. It's just wet now with a big butt. Baby, the cooch don't change. I don't know why y'all feel like the cooch is gonna change. It's not gonna change. It don't go hand in hand. Yeah, I just can't. The stuff that I be hearing sometimes, I'm like, I guess. I don't know. It's just so far barbaric stretch that I just don't understand. But that was my little TED Talk, my little chit chat. I hope y'all enjoy. Y'all know what I'm going to tell y'all. Please comment. You don't have to agree with me. You can disagree with me. You can tell me exactly how you feel. Listen, I don't get mad. I don't tussle if we disagree. I just like to listen to the person's point of view, and that's just it. You could agree with me. You could disagree with me. Baby, I'ma still love you. All right, boo things. And then y'all tell me other topics that y'all want me to talk about. I did not forget my other ladies who want me to address how to pick out a F-boy. Woo, baby, that's gonna be long too. Because baby, when I tell you, I think that I have to make a list for. Because baby, when I tell you I see it, and I'm going to tell y'all. Until next time, my love bugs. You know I love y'all a long time. Bye.